My name is Harrison Sailing. I'm an associate veterinarian here at Santa Monica Pet Medical Center. I went to Cal Poly San Luis Obispo, or Cal Poly SLO for short, for my undergraduate degree. I went 4 years there, got my bachelor's in animal science, and then luckily got into vet school right after finishing college, and so didn't take any breaks, just went straight into veterinary school after that. So my veterinary school was at St. George's University, which is actually in the Caribbean. It's on an island called Grenada. Had a great time there. It was another 4-year program. Unfortunately, we started right during COVID, so our first year was actually online, but then we actually eventually went to the island and it was a total of 3 years on the island, and then as part of the program, they send you to a teaching hospital elsewhere, and so I did my 4th year at Ohio State and finished up in 2024, and then worked as a small animal veterinarian in Culver City for about 1.5 years, and then just joined Pet Medical Center in March of 2026.
What do you like to do for fun when you're not at work?
So I kind of have a couple hobbies I like. The one that is most recent and I do probably most regularly is calisthenics. Living in Santa Monica, we're very lucky that we can be outside and go to the beach like over 300 days a year. So I do like to do that on a regular basis. I have a group of friends and a nice community at Muscle Beach here in Santa Monica to work out and stay active and get out in the sun. And then I also love music just in general, particularly electronic music nowadays, but really all genres. So I love a good concert or music festival is the best way to get the most bang for your buck because you see a bunch of different sets at once. So I really like that. And then another recent hobby that I just took on is snowboarding. So I do like to go snowboarding. Obviously, we're lucky in California to have Mammoth Mountain and Big Bear so close. So I've gone a couple times to Mammoth and then once in Vermont as well. And so I'm trying to get good at snowboarding as well. So a topic I wanted to address in veterinary medicine is heart disease and heart murmurs, and it's a little bit different in dogs and cats. So I guess I'll talk about the dogs first. Dogs can get a variety of different heart diseases, but particularly in small dogs, what's most common is a disease called mitral valve disease. It is a disease that's degenerative, meaning that it happens over time as the pet ages. And so that can result in a murmur sound that we hear when we listen with our stethoscope on exam. And so the importance of identifying murmurs early is crucial because there are certain medications that might be necessary, and also the presence of heart disease can impact things that we do in the future, such as anesthetic procedures, surgeries, dentals, things like that. So whenever I hear a murmur in a patient, I do recommend an echocardiogram as the next step to further evaluate that. It's a really non-invasive procedure that's done by a cardiologist. That's just an ultrasound of the heart, and so they are able to look at all the structures in much more detail, determine if there are medications that are necessary, and if the patient's a good candidate for anesthesia. And so it's just good to not only catch those things early and treat when necessary, but also make sure that the patient is as safe as possible for those procedures. So again, in dogs, it really is most commonly mitral valve disease. They can get other diseases as well. There can be congenital diseases that dogs are actually born with, less common, but it's possible. And so echocardiogram is a great tool for identifying those pathologies. For cats, it's a little bit different. They still get heart disease. They get a disease called hypertrophic cardiomyopathy. Works a little bit differently than mitral valve disease in dogs, but it can still result in a murmur sound. And so in cats as well, I do recommend an echocardiogram whenever I hear a murmur for the same reasons, identify changes, determine if medications are necessary. But for cats, I do recommend it, not more strongly, but I'm a little bit, I guess, more forceful about it because cats are really good at hiding disease. And so there's some cats that have a very soft murmur or even no murmur at all and have what we call occult heart disease, meaning hidden. And so I just think regardless if we do hear a murmur, it's important to further evaluate it. In cats, dogs can get it too, but cats can also get what we call stress or physiologic murmurs, where just being stressed in the hospital causes that increased blood flow through the heart, and that can cause the murmur sound, which is obviously best case scenario, but in that case, there's nothing actually wrong with the heart. It's just that increased blood flow that we're hearing, but without an echocardiogram, it's hard to tell if that's actually the case. So that's my little spiel on heart murmurs and heart disease in dogs and cats.